Good afternoon, everyone, and thank you for joining the webinar. This is Being Tobacco Free, How Behavioral Health Organizations Can Meet the Gold Star Standards of Excellence with the Breathe Easy program. My name is Sarah Mayberry, and I'm here with my colleague, Meg Netto, and we're excited to chat with you over the course of the next hour about some strategies and background, as well as talking about the first annual Behavioral Health Gold Star Standards of Excellence program here in Maine. Just a couple of logistics before we get into the webinar. All participants are going to be muted throughout, so we make sure to reduce any background noise. We'll be answering questions at the end of the webinar, but we know that sometimes those come up throughout. You're thinking about it or hearing one particular slide, so we want to make sure you know that you can ask your questions by putting them in to the question box on the GoToWebinar control panel at any time, and we'll be sort of tracking those and answering them at the end. Also, we are going to be recording today's webinar, so if there's information you want to go back to or colleagues that you want to share this with, it will be recorded as well as posted on our Breathe Easy YouTube channel, and we'll also email it out to you, so within the next week. To give you that background of where we're going to go over the course of the next hour, I'm going to give a little bit of background about us, talk about the case for smoke and tobacco-free policies, and specifically why that's important in behavioral health organizations. Then we're going to talk about the 2017 Gold Star Standards of Excellence, background about what the program is, as well as the specific 10 standards for this year and how to meet them. Some of the resources to help you with that, and important dates to keep in mind. And then we'll go through those questions. So a little bit of background about Breathe Easy. We're working to reduce exposure to secondhand smoke through the promotion of strong voluntary policies that lead to reduced tobacco use and increased tobacco-free living. This is a statewide effort that targets 4 key environments, including behavioral health organizations, and we're excited to have it as part of the statewide Maine Prevention Services Initiative, where Maine Health Center for Tobacco Independence has programming to do tobacco prevention and supporting tobacco-free environments work, including the Breathe Easy initiative. So why is this important? Why are we talking about tobacco? We really want to bring it back into what are some of the important points. We know that tobacco use remains the leading cause of preventable disease and death in the United States. On the right-hand side of the slide here, we have a couple of images of fairly recent Surgeon General's reports on tobacco. There have been numerous since the first report came out in 1964 that stated that smoking was harmful to your health. And unfortunately, we still see about 1 in 5 Maine adults continuing to smoke. So this is something we want to be able to address, continue to have organizations like yours that, as behavioral health agencies, to be stepping forward to address tobacco use so we can continue to reduce the burden of tobacco and the diseases and deaths that can be related, which can include cancers, cardiovascular issues, and other components. We also know that by creating tobacco-free policies, which is what we're talking about today, that by creating these tobacco-free areas, you're helping to change the social norm around tobacco use and promote tobacco-free living. Meg will go a little bit more into it in her slides about the social norm and really the evidence base behind that, but it's really a great thing to think about that when we're having this opportunity with a policy, not only are you reducing exposure to secondhand smoke, but you're supporting those who maybe are thinking about quitting or trying to quit to be tobacco-free as well. And also that we're going to go into some more specifics on this later on, but we talk a lot about smoking and smoke-free policies and talk about sort of the traditional tobacco products, but it's important to remember that the Surgeon General has stated there are no safe tobacco products. So when we talk about cigarettes, cigars, chewing tobacco, snuff, snus, and little cigars and cigarillos, that all of these products fall under this tobacco product norm. And then when we lump in our electronic smoking devices or our e-cigarettes and vape products that contain nicotine, that these products can be very addictive and there are many carcinogens within those that are the tobacco products, so they're not safe for any use. We also unfortunately know that this can be an environmental issue. So when you're trying to make your case for why you're going to address tobacco and creating a tobacco-free environment, looking at it from the fact that cigarette butts are the most littered item in the U.S. and the filters are not biodegradable can be a great sell as well. So I just mentioned that there were all of those 30-plus Surgeon General's reports on tobacco use and exposure over the years. I think one of my most powerful lines that I like to repeat from those is that the Surgeon General has repeatedly stated that there is no risk-free level of exposure to secondhand smoke. Secondhand smoke is when the burning tobacco that's coming off the end of a cigarette or being exhaled by a person who's currently smoking. Unfortunately, we know that there are a lot of chemicals, more than 7,000 within that secondhand smoke, at least 69 of which are known to cause cancer in humans. And it can be especially harmful to those who have breathing or cardiovascular issues existing or to youth. So by reducing that, by making smoke-free environments can be really helpful. And we know that exposure can increase non-smokers' risks of ending up with heart disease or lung cancer. So by having this prevention, you're really able to help a lot of health. Also know that Maine law covers really good smoke-free indoor environments. We're a lucky state that's been very proactive in this, so making sure indoor workplaces and public places are smoke-free. But having these campus-wide or organizational-wide smoke-free and tobacco-free policies can be important because multiple studies have come out to show that secondhand smoke poses a significant health risk in outdoor settings as well. And the research finds that smoking within 20 feet of a non-smoker can cause harmful levels of exposure that can be as high outside as they are in indoor settings. So it's really important to make sure that you're moving that tobacco use away from other people and away from the entryways, doors, and ventilation systems from your building. We've known about secondhand smoke. The first Surgeon General's report on it came out in 2006, stating about the fact there was that no risk-free level of exposure. But more recently, we're starting to learn about this emerging titled issue called thirdhand smoke, which is the lingering tobacco smoke residue that remains after a burning tobacco product has been put out. So this is those pesky toxins and scents that remain after smoking has ceased, and they stay on clothing, hair, skin, and surfaces, and unfortunately, they still contain many of those cancer-causing and toxic chemicals. Also, this stuff is really annoying because it can build up over time on surfaces and is resistant to normal household cleaning. So we're seeing in a lot of settings, especially childcare or healthcare, where people are including reducing the fragrance from thirdhand smoke or reducing that lingering residue from in their fragrance-free policies. So making sure, because knowing that this can impact others. And so wanting to include that within your policy language as well and being mindful. Asking those who are going out to use tobacco that they're washing their hands, possibly putting over a coat or something on over that if they're going to be working with those who are sensitive to thirdhand smoke, those with asthma or children and infants. And I'm going through with some very high-level points on a lot of these components around our background on tobacco use, second and thirdhand smoke, mostly because I want to make sure we have time to get to the meat and potatoes of this, which is our Gold Star standard. But we do have a lot more information on our website, including rack cards and fact sheets on these specific issues that will have that link at the end of the presentation. So when we talk about it, when I hit on earlier that we want to make sure we're talking about all tobacco policies, all tobacco products for our policies. There's a lot of reasons for that. We have our smokeless tobacco products that are those that are not burned. You'll see here on the image on the screen showing a variety of them between your chewing tobaccos, oral tobacco, spit, and spitless, dip, chew, and snuff and snooze by a lot of different names, but really are putting with that smokeless tobacco that's being put orally into your mouth, either to be into a pouch or to be chewed. Sometimes it's being spit, or some of the newer ones like the snus that's dissolvable. But that unfortunately the tobacco companies are creating these flavored and dissolvable forms that can sort of melt away and be really easy to use, and can also be able to use in smoke-free areas. And they can have sweeteners or look and taste like candy, which is especially dangerous when we talk about kids. But including those products also in your policy, making sure it's smoke and tobacco-free, that it's including all these different products, is so we're not encouraging dual use. Because, again, we know that nicotine is really addictive, and we want to support people to have those healthier lifestyles, but how we make sure that we're doing that without substituting other products, such as some of the smokeless products that we know that can also be found to cause cancer because of some of the chemicals. One of the emerging products that comes up a lot when we're talking about creating smoke and tobacco-free environments and working on these issues is the emerging electronic nicotine delivery system. So when I talk about ENDS, which is the acronym for that, this includes that wide array of new sort of electronic products. So your e-cigarettes, the vaporizers, vape pens, hookah pens, e-pipes, and electronic smoking devices, and probably so many more that I'm not going to spend the whole hour rattling off names. We've got an image here showing how they can vary in look, knowing it expands even more beyond this. But these are those emerging products that are gaining popularity. We know that their use, that if they include nicotine in them, can lead to nicotine addiction and negative health impacts. We also know that they are not approved by the FDA as a cessation device, even though there's a lot of misconceptions out there about that. But we also know that the vapor from these products can release nicotine and other cancer-causing chemicals. So it's not the same as secondhand smoke, but there is that secondhand vapor that's happening. There's also the lookalike components where it can make it undermine sort of your tobacco-free policy if these products are being used separately. In 2015, these products were added as electronic smoking devices under the workplace and public place law. So in those indoor locations that we talked about that are covered by Maine law, and Meg's going to talk about that a little bit under some of the rules for behavioral health organizations, that these products were included in that, but there's an opportunity to raise education and awareness, as well as extending beyond that. One of the other concerns about these emerging products when thinking about their use and how they relate to your smoke and tobacco-free environments, as well as your drug-free environments, is that these products can also be used for other substances. So not knowing, and we're seeing that vapor coming off, we don't know what's in there. So by including these products in your policy can go a long way to make sure we're addressing both the smoking and the nicotine, as well as potentially some marijuana or other issues within that. So it can be a good win to include that. My last piece before I want to turn it over to Meg is to just come back around to that environmental reason for going tobacco-free. So we've talked about the health reasons, both for the individual who's the tobacco user, as well as for those who might be exposed to secondhand smoke or the social norming for youth, and helping and supporting those who are trying to quit. But we also know that there is a going green factor of being smoke and tobacco free. As I mentioned earlier, that cigarette butts are the most littered item in the United States, making up nearly 38% of all collected litter in the country. And nearly all cigarettes, about 98%, have plastic non-biodegradable filters. And in addition, those toxins, once they're on the ground, if it's raining, all these different pieces that can leach into the ground and water. So this is another factor if you're trying to sell your tobacco-free policy and get buy-in. But also we've had the anecdotal reports from a number of organizations that we've worked with that have gone tobacco-free, that they have said that their facilities and cleanup costs have been reduced because of the not having to be out on the grounds cleaning up that tobacco-related litter because people aren't dropping the cigarette butts. So it's actually had a positive economic impact on their campuses or organizational grounds by needing to spend less staff time and energy on addressing this. With that, I'm going to turn it over to Meg.
Thank you, Sarah. So we've given you a lot of background information around why tobacco. So, but more specifically, in thinking about the fact that you are working in the behavioral health setting, is why we want you to be addressing tobacco use with behavioral health populations. So the smoking rate among adults with mental illness is 70% higher than adults without mental illness, and almost half of the 443,000 deaths per year from smoking are of people with mental illness and or substance abuse disorders. I mean, that to me is an absolutely staggering number. And then 44% of cigarettes consumed in the U.S. are by people living with mental illness or substance abuse disorders, and 1 in 3 adults living with mental illness struggle with tobacco use. And we know that these people want to quit just as much as adults who smoke that don't have mental illness or substance abuse disorders. So it's not that they don't want to, but it's maybe they have added challenges when it comes to quitting. There's additional support for addressing tobacco if you're a behavioral health organization in the state of Maine with a contract with the Maine Department of Health and Human Services. Maine DHHS is supportive of addressing tobacco. So in your contract, it's actually, I believe, Rider E, there is a statement that with your current contract, you need to have a written policy addressing the inclusion of a tobacco assessment and the need for treatment in all plans of care, annual screening of individuals for tobacco use and dependence using best practice assessment protocols, tools, and procedures, referring individuals who are identified as current tobacco users to evidence-based tobacco cessation treatment, if that is within a good course plan of action, and a tobacco use policy that at minimum needs to comply with state laws in your facilities, on your property, and all locations where services are delivered. The statute reference is there if you're not familiar with what Maine state smoke-free public place laws are, but really the quick nuts and bolts of it is all indoor places, employer-owned or leased vehicles, and that includes smoking and the use of electronic cigarettes. So, and when you're outside, at least 20 feet from any door, window, vent, HVAC unit, ultimately where secondhand smoke could be circulated back inside to the building. So these 4 things here need to be reviewed annually with all staff and updated as necessary. And if you change your policy, if you go from a smoke-free policy for your organization to a tobacco-free policy, an update, you should submit that to your DHHS program administrator when you update it. So the impact of tobacco-free policies, I think Sarah had touched on this at the beginning, is we know that tobacco-free policies reduce exposure to secondhand smoke for your clients, employees, and any visitors. They support healthy social norms that don't include tobacco use. Tobacco-free policies help increase the number of tobacco users who quit and support those who are actively trying to quit. And for those who have quit, help them stay quit. It reduces the initiation of tobacco use, especially among young people, and it shows a commitment to a healthy environment. So with all of that, what is this new Gold Star Standards of Excellence program? So this is a new program for behavioral health organizations. We have done it for the last a number of years with hospitals and then colleges and universities in Maine, and we're now expanding to the behavioral health population, and we're really excited about it. So it's a voluntary recognition program to recognize and support and encourage behavioral health organizations that have created and maintained tobacco-free environments and or support tobacco-free living. So there are 10 evidence-based tobacco control standards that your organization can meet through written policies and procedures, and it's an opportunity for your organization to be highlighted for leadership around addressing tobacco in your community and throughout the state. So these standards, we review them annually. Well, we will. This is the first year we built them to ensure that we are encouraging organizations to continue to meet these best practice standards for tobacco-free policies and support tobacco-free lifestyles. We notify organizations when the application's been released and encourage everybody to participate. I know we've been sending out emails and we've posted it on Facebook and things like that. So any behavioral health organization in the state is encouraged to apply, and organizations that meet at least 6 of our 10 standards will be recognized at our awards celebration event, which we'll be holding in June. We'll get the specifics of the date at the very end. And again, this web link here at the bottom, breatheasymaine.org/behavioral health, is where all of these details can be found. So I will turn it back over to Sarah. She'll go through the first half of the standards and we'll move on.
Awesome. Thanks, Meg. As you just highlighted, we're really excited about this, but want to make sure we're giving that background. So what we're going to do is go through, I'm going to state the standard, and then Meg has pulled together some really great pieces about how you can meet it with those examples from what behavioral health organizations are doing. So we'll go through each standard as well as giving some background of a real-world example of how you can meet that standard. And that reminder that we know this can be very overwhelming to look at all 10 at once, but knowing that oftentimes your organization is doing a lot of this already. So our first standard is really around that tobacco-free environment and creating that policy. And so the standard states that the behavioral health organization has a 100% tobacco-free campus policy prohibiting the smoking and tobacco use of all products. And then we have a pretty broad definition here to highlight all of those different products we talked about in the early parts of the presentation. So your cigarettes, cigars, pipes, smokeless tobacco, electronic smoking devices, to make sure that there's that really that inclusiveness of addressing all tobacco products and everywhere on your campus. And also highlight that the policy should be for all employees, clients, visitors, and contractors, and that they're all held under that same standard of not using tobacco products on organizational property, including parking lots and vehicles parked on the grounds, as well as on those organizational owned and leased vehicles and at satellite facilities. So to meet this standard, you have to have this policy language, have that tobacco-free environment. And what we ask is that you have a written policy that covers this, and to meet the standard when you're filling out that application, you provide a copy of the current standard, the current policy with it. So this is a sample answer that we had from an organization that said, our organization is dedicated to providing a healthy environment for all clients, employees, and visitors. Therefore, on July 1, 2015, our organization adopted a 100% tobacco-free policy. The policy prohibits the use of tobacco products, including e-cigarettes and vaporizers, in all buildings, in our parking lots, including personal vehicles parked on the ground, and then they attach their tobacco-free policy with it. So that's really sort of the big standard that we know to create, but also knowing that can be one of the really hard ones. But it can have a lot of lasting, meaningful change. So the second standard is really around what do you do to let people know about that policy. This can be met whether you meet standard 1 or not. That's oftentimes has been a question. So hopefully you have strong policy communication to whatever level your organization's policy is at. And so this is trying to follow best practices for that. And it states that written policies, procedures, or plans detail the communication about the behavioral health organization's policy to clients, employees, visitors, contractors, and at all satellite offices, buildings, and other properties owned or leased by the behavioral health organization. This is really finding all those different ways you could communicate your policy. We ask that there are at least 3 strategies that you're meeting. Within the application, there's a whole checklist of some of the most common ones we know people take on, but there's also an opportunity if you found some innovative or different way to do it that worked for your organization to write that in to help you meet your 3. And then provide some documentation of how those strategies are met. This might even just be information that's right in the tobacco policy that you're including. It could be a picture of your signage and different areas. So the sample strategies that were met here for our example were signage can be found throughout the grounds, including at entrances to the property and buildings and parking lots and other outdoor seating areas, and where people tend to gather. A second strategy that was followed is that employees are asked to acknowledge in writing on an annual basis that they understand the policy. This is a practice that we've seen a lot of organizations put in place, that helpful reminder to increase compliance of just asking people to sign off that they know the policy. And the last one is that information about the policy is available on the organization's website or through HR. And so in this example, they wrote the fact that the information on the policy is provided to all employees when they're new and on an annual basis, as well as to new clients. And they have signs up in the parking lots and on entry doors, as well as a policy sign posted on the bulletin board in the reception area. So a lot of different comprehensive ways to get the word across. The third standard, so as you can see, we're building on each other. We had policy language, then we've got policy communication, now we're talking about policy enforcement. So standard 3 is the written policies and procedures or plans that detail policy expectations and enforcement, including how noncompliance is addressed. I know this can be one of the harder parts, but it's really important to have this set in writing so that people have an understanding of what the expectations are for following and complying with this policy. Ooh, jumped too quickly. All right. So for this policy enforcement standard, again, we have a list of some best practices that you can follow. So if you're looking at this, go on to that online application and check those out for some of the strategies. But you need to have 3 strategies that you're working on, similar to communication for policy enforcement, and ask that you provide documentation on how these strategies are met. So this sample answer was that our policy clearly outlines who's responsible for enforcing the policy, and that is that it's the responsibility of all employees to remind those who they see violating it that they're a tobacco-free campus. And also stating that the policy outlines who's that responsible for it, and that clients receive information on the policy at their initial appointment, and again as necessary to remind them of it. And that there's also leadership walkabouts that are going around to see where there's issues, maybe with people not following the tobacco policy, to offer education and request compliance, so showing that there's administrative buy-in for that. All right. Next up, we have tobacco advertising. Meg highlighted the fact that this is a social norming component, that we want to make sure that we're not that we're making sure that people feel supported to be tobacco-free and for these wellness components. So for standard 4, it's restricting tobacco advertising. If advertising or promotion of tobacco products is not allowed on the property, including all satellite offices, buildings, and other properties owned or leased by the organization, this includes publications and magazines subscribed to by the organization for placement in waiting areas. So this is one of the big components, is making sure that you're putting in a strategy to sort of disconnect your organization from that tobacco advertising or those pieces that might be targeting your clients or your staff. So it's finding one strategy to take this on that shows how your organization is making steps to regulate tobacco advertising on campus. So the sample strategy was that a notice was placed in a magazine area that states the organization does not support tobacco advertising. And here's a great example that's been used, was that they stated that any and all donated materials from the community or employees are required to be screened prior to distribution to their reading areas to ensure there's no tobacco advertising contained within them. Laminated signs are posted in the magazine stands and racks and on tables stating that our organization does not support tobacco advertising. Information is also provided on the signage referring individuals to the Maine Tobacco Helpline and including the phone number for the helpline there. So not only are they saying we don't support tobacco advertising, they're also connecting them to evidence-based treatment for quitting. So next up is number 5, which is your tobacco dependence and treatment education standard. And this is your standard where it's saying that information about tobacco dependence, secondhand smoke, third-hand smoke, and tobacco treatment resources are readily available to clients, employees, and visitors. For example, educational brochures or posters are displayed in the lobby, waiting area, and/or treatment rooms. So this is making sure all those pieces we just chatted about the dangers of tobacco use and second and third-hand smoke, or talking about resources like the helpline, that's not just staying within all of us who are in these webinars and working in the areas, that it's being able to get out there to your clients, employees, and your visitors. So the purpose is to provide that information on tobacco dependence and the benefits of quitting, so that it's reaching folks. And then what we ask to complete and meet this standard is to describe how resources are made available to clients, employees, and visitors, and what type of materials are provided. So in this sample answer, it says that information on the benefits of quitting, tobacco dependence treatment, secondhand smoke, thirdhand smoke, and treatment resources are communicated to patients and visitors. Various materials from Breathe Easy, the Maine Tobacco Helpline, and other educational materials are available in waiting areas, client packets, and on bulletin boards throughout the organization. So that's a really great way that they showed a comprehensive reach of how to address the standard. And so now I'm going to turn it over to Meg to go to standards 6 through 10.
Thank you, Sarah. So standard 6, actually the next few kind of get into those contract requirements from Maine BHHS. So standard 6 is screening clients for tobacco use and dependence. So this states that all clients are screened for tobacco use at initial appointments and annually thereafter. Tobacco use status is documented, and clients are offered comprehensive evidence-based treatment services. So as we noted before, this is a requirement if you have a contract with Maine BHHS to provide mental health or substance abuse services, and we ask that you describe this process, what your process is. So the sample answer we have here says our standard operating procedures require all providers to screen every client on their tobacco use by assessing a client's tobacco use status, incurring current and or any past use, the type of tobacco, and how frequently the patient uses it, patient or client, along with how long they have been using tobacco or smoking. So it's documented in client files and then revisited annually. So standard 7 builds on standard 6 and talks about evidence-based tobacco treatment. So clients identified as being tobacco dependent are offered comprehensive evidence-based treatment services incorporated into their current treatment plan. So this can include cessation counseling, clinical assessment and managing for nicotine withdrawal, and or offering FDA-approved nicotine treatment medications. So for this standard, again, we're just asking you to describe how evidence-based treatment services are accessed. So the sample answer here that this organization has said is any clients identified through the screening process as a tobacco user will trigger an automatic notification for the provider to give them tobacco cessation education. So this can be as simple as having a conversation around assessing a readiness to quit. And then if there's an interest in quitting, if the provider can provide cessation counseling, incorporating that into their treatment plan. If not, then, or assistance with managing nicotine withdrawal. So giving them the information about how to use FDA nicotine replacement therapies. So it's having the provider know what the best practice is for moving forward with their clients and knowing their client relationship and making sure that they are, talking to them about evidence-based tobacco treatment. And then number 8 is another further step talking about a referral to evidence-based cessation. So clients identified as being tobacco dependent and interested in quitting are referred to evidence-based tobacco cessation, such as the Maine Tobacco Helpline, or if you have certified tobacco treatment specialists in your practice, that's fine. Again, we're asking you to describe the client referral process to cessation treatment services, either referred or if they are being done in-house, that is fine. We just need to make sure that you are giving us that information. So clients identified, the sample answer here says clients identified through the screening process as a current tobacco user and with an interest in quitting, which would have been identified in the previous steps, is referred to evidence-based cessation treatment where the provider and client agree on the best course of action to assist with quitting tobacco. In some instances, this may include a direct referral to the Maine Tobacco Helpline. We know there are some organizations that have the ability to submit a fax referral form right to the Maine Tobacco Helpline, which then would trigger staff within the Maine Tobacco Helpline to actually call your client instead of having your client have to make the first outgoing phone call. So there are some great things that can be done here to make sure that clients interested in quitting are being referred to evidence-based cessation. And we know not every client is going to want to do this. The rationale behind the standard is to make sure that there is a policy or procedures in place for this referral to happen when clients who are tobacco users say, you know, I'm really ready to address my tobacco use and I want to quit. So standard number 9, we're getting there, we're almost to the end, is evidence-based education for employees. So we've talked a lot about what is going on between the provider and client relationship, and now we want to make sure that your organization is supporting its employees to be educated around tobacco. So this standard says the behavioral health organization supports evidence-based tobacco treatment training for employees by offering in-services on tobacco treatment, supporting staff financially to attend trainings, and/or providing access to literature and resources on-site for staff. And trained tobacco staff are available to provide treatment and counseling to tobacco-dependent clients. Again, this does not have to be everybody, but it is that there are these supports in place for your employees. So with this standard, we ask that you list the number, we don't need names, the number of employees who have been trained on evidence-based tobacco treatment counseling and education, and/or the number of tobacco treatment-related activities held over the past year. So this organization's answer, which we thought was really great, says our organization supports our providers with continuing education and training to attend local, regional, and/or national conference on tobacco treatment and substance abuse to keep current on best practices. Last year, 8 of our providers were able to attend the Tobacco Treatment Conference in South Portland, and we had 2 trainings provided in our office on tobacco treatment practices, as well as it sounded like staff had listened to multiple webinars. If you're not connected to all of these resources, there are a number of tobacco treatment resources available across the state. At the very end, we'll give you our contact information. We can definitely hook you up with these if this is something that you're needing or wanting more of moving forward. And the final standard is the tobacco treatment benefits for employees. So this is tobacco treatment services are a covered benefit in the organization health insurance package for employees and their dependents, and that these benefits include coverage for counseling, medication for quitting tobacco, with minimal or no barriers to utilization. So this is at out-of-pocket cost or yearly limits. And here we ask that you describe the tobacco treatment plan benefits offered and how they're promoted to employees. So this answer, our employee health insurance covers tobacco cessation products approved by the FDA by a prescription from a primary care provider's office. This benefit is covered at 100% with no deductible. Additional benefits include tobacco cessation classes or treatment groups with a minimal out-of-pocket copay. We know not everybody's health insurance policy is going to be the same, but we just need a couple of sentences as to what that treatment benefit is in your health insurance. So those are the 10 standards that we are hoping organizations will look forward to. We'll get to a few more details on those in just a minute. But the other piece of the Gold Star Standards of Excellence program, excuse me, is this individual Gold Star Champion Award. So at the end of the online application, or the very last page if you download the Word document version of the application, there's a nomination form where whoever's filling out the application can nominate another person or a group or yourself if you want to do that. We encourage that. We know that 99% of the time the person filling out the application is the champion for their environment, for their organization to be a tobacco-free environment. So this is a special acknowledgement of these champions for smoke and tobacco-free policies and lifestyles for your organization. And we want to celebrate you. So there's a short little form. It asks for their name, email address, your name and email address, and why this person is a Gold Star champion. A couple of sentences as to what this person does that really helps support the tobacco-free policy is what we're looking for here. And it's always kind of fun. The picture here is from our last college awards program where we're recognizing somebody. So the resources available. So this, as we've mentioned, there's an online application form. If you go to breatheasymaine.org/behavioral health, right under the little video box is the direct link to the Gold Star Standards information page for the behavioral health group. And then on that page, there's the online form or where you can download the Word document from the online version. we have a guidance document listed, which really is just a paper version of this entire webinar. It gives you the same standards and sample answers. And we have local contacts throughout the entire state that can help you with this application process if you're having questions or feeling really overwhelmed. If you reach out to us, and our contact information is coming, we promise, reach out to us and say, hey, you know, I'd really like some help with this, we will connect you to that local partner who can help you provide assistance. And one thing that I don't think we've really haven't necessarily made super clear is it doesn't matter if your organization meets all 10 of these standards. You don't have to. We are looking for you to, we're looking for everybody to apply for this recognition because we think it's a fantastic thing to celebrate. So on the application, if you don't meet, say, standard number 1, if you don't have 100% tobacco-free policy, just write not applicable in that first box and then check all of the other, write all of the other answers that you meet for the rest of the standards. So we recognize organizations at 3 different levels, bronze, silver, and gold. And you'll notice on the application when you look at it that the bronze level you meet between 6 and 7 standards, silver if you're meeting 8 and 9, and then we recognize things at the gold level if you meet all 10 of those standards. So we're looking, we have a wide variety of where people are at, and we just want to recognize everybody. So important program dates to keep in mind. Applications are due Friday, May 5th, which is a little over 2 weeks away, I think. I can picture a calendar in my head. And then we want you to mark your calendar for Wednesday, June 7th for the awards celebration event and networking. It'll be from 11 a.m. to 1 p.m. We don't have an exact location yet. This will likely be in the Augusta area. We do serve lunch, and we have a lot of fun, you know, handing out we give you really fancy plaques for your awards level, and then we have the individual Gold Star Awards, and then a chance for organizations to kind of share amongst themselves, you know, what's working really well, what challenges people are facing. We've had a lot of fun with these over the last few years. And with that, if you have any questions, now is the time to enter them into the question box. Again, more information is on the website, breatheeasymaine.org/behavioral health. And there is our email address. If you email us at breatheeasy@mainehealth.org with any questions related to tobacco policies, the Gold Star Standards program, we'll be able to connect you with either, if we can't answer your questions or if you need help with the application process, we will connect you with your a local partner.
And thanks, Meg, and thanks for all those great components. Also that we like social media and we like to be connected. That one of the great things we get to do through this program is that celebration of folks, and we try to highlight that on our social media pages. But also want to make sure that you can stay connected with us there for updates on tobacco-free policies, on emerging issues, Facebook, Twitter. All the archived webinars are on YouTube, and we have an Instagram account where you'll see pictures of lots of examples of tobacco-free signage across the state, because that's what gets us excited. But those are a lot of great opportunities and some pieces that we're excited you were able to join today's webinar to be able to look at, and so just wanted to give it a minute to see if there are any questions, because we know we're throwing a lot of information at you. But again, to know that that's why through, I think, all 6 of these forms of communication between social media and email and website, that we hope to be super accessible to you, so that if those, as soon as you get back to your desk and the regular things after this webinar, that we can also answer those. Awesome. Turns out we had a really comprehensive presentation then. Left it open. I want to thank you so much for joining us. Please, we'd love to see you participate in this inaugural program. We're really excited to be able to celebrate what Maine Behavioral Health organizations are doing to address tobacco. So keep your calendar marked for May 5th, and hopefully we'll look forward to being able to see you on the 7th of June. Thank you.
Thanks.